My name is Tyler Johnson. I'm with the FSCJ nursing program, and today I'm going to be demonstrating the Piggyback medication bag. Alright, so I have my MAR, and the doctor's orders vancomycin 200 milligrams over 2 hours, and the drop factor is 10 drops per milliliter. Available, we have 100 milligrams per milliliter, and the mini bag comes in 50 milliliters of normal saline. And so, since the doctor ordered 200 milligrams over 2 hours, we're going to do dimensional analysis here, and we're going to have 50 milliliters over 2 hours, which is the normal saline, with a drop factor of 10 drops per minute, and that'll equal out to give us 4 drops per minute as our drop rate. We're going to check the lab values as well with this patient since we're giving vancomycin. Some of the lab values we're going to be checking is the BUN creatinine levels, the white blood cell count, because we are giving an antibiotic. We're going to make sure, check to see if the white blood cells are in range to be giving this medication. We're also going to check the albumin, which all of these are within normal limits. We have a white blood count of 5, and we have a albumin level of 4, and BUN level of 7. So it's a little low, but it's within normal limits. Okay, so we're going to get started. I'm going to explain vancomycin. The action, it binds the cell wall, causing cell death. The purpose is to treat infections. It's a very potent antibiotic. Some of the side effects is ototoxicity, hypotension, Red Man syndrome, which comes with using too quickly. Recommended dose for an adult is 500 milligrams every 6 hours. Contraindications is hypersensitivity to the drug and renal impairment. Nursing implications, assess vital signs, assess for infections, monitor IV site, and monitor blood pressure. Okay, so I'm going to go ahead and get all my supplies. I have my vancomycin, I have my kit. So I'm going to wash my hands in the drug room. Yes. Okay, drug 2.
I'm going to check the patient's chart for any known allergies. In this case, there are none. And I want to check the physician's order to make sure we're doing the correct procedure, which in this case is an IV insertion. So I'm going to explain to the patient, we'll be putting in an IV, and ask if you have any questions.
Okay, got 2 mils.
Before we get started,
I have my medication bag.
and grab my materials.
Go ahead and clean up
So I'm not scrambling
bag.
as I'm inserting the IV.
and check my medication in my bag. Okay, sharps container.
I have 3 milliliters of saline already prepped in the injection tube.
Okay, go ahead and mix my bag.
Go ahead and just always
Okay,
use
so
sterile
I have
environment
that.
for the patient.
Try to make a mix. Got my gloves. Got my tubing. It's my bag.
Help me look here.
I'm gonna go ahead and put a label on the medication bag. I got the name of the patient, the date, the flow rate, what the medication is, how long it's supposed to be flowing for, and I also what's infused in this bag, and I'm gonna go ahead and initial it myself. So let's go ahead and go in the patient's room. Alright, in the patient's room. Good morning, Mr. Jones. My name is Tyler. I'm going to be your student nurse today. While I'm talking to the patient, I'm going to go ahead and look at the site. I'm not going to touch anything. I'm going to go ahead and wash my hands. Mr. Jones, do you have any pain at the insertion site here? Any tenderness? I don't see any redness, no phlebotomy or anything. And I'm also going to go ahead and just make sure this is dripping correctly. Make sure the line's painted, there's no leakage or anything. Mr. Jones, we're going to go ahead and hang a piggyback for your vancomycin. Go ahead and get that flown. Do you know why you're getting vancomycin? Okay, yeah, you had a little infection going on. Doctor wants you to get some vancomycin. Mr. Jones, can you go ahead and restate your name, your date of birth, and any allergies you might have? Okay, great. And I'm gonna just go ahead and double check on the MAR to make sure that I have the right medication, the right patient, the right route. Alright, we're gonna go ahead and set you up here, Mr. Jones. So, I'm gonna hang
Make
this.
sure the skin's tight, so I use my bar.
Go ahead and prime my tubing. So to do that, I'm gonna get a little fluid in here. Good. Go ahead and let it out just a little bit.
How was that one looking? It was looking better, yeah, it was.
Alright, tube is nice and primed. Alright, and I use an alcohol swab.
She got that 64 gigabyte one.
Yeah, right? It's worth the
An
extra money.
alcohol swab.
It's 16.
We're gonna clean the port here.
I'm just like our racing things.
And that's nice and clean.
They were like, oh,
Go ahead. Insert.
No, it's going smooth.
it was, right?
Okay.
I was feeling.
Before I start anything, this is all clamped off. I'm gonna go ahead and lower my bag. Okay, then I will go ahead and
Yeah, it did.
Open this.
I wanted to be smooth.
so I have to have my drop rate of 4 drops per minute. Open this one up.
No, the other one was 6 minutes, huh?
Looks good. Alright, while I'm here, I'm gonna go ahead and assess. Mr. Jones, you feel any pain right here, any tenderness? No, there's no edema, no redness, no swelling. Patient's pain. Mr. Jones, can I get your personal belongings for you? Okay, great. Do you have to use the restroom while I'm here? No, you experience any other pain anywhere else that I need to know about? Great. Also, position, are you comfortable? Can I move you or anything? No? Great, okay. Alright, Mr. Jones, everything looks good. Your drop rates are good. I'll go ahead and take this off and wash my hands. I'm gonna go back to the computer and document that patient understood what was going on and received the medication well, that the site was nice, no phlebotomy, no irritation at the site, no swelling, no redness, and also that there was patency, and document medication that I give and the flow rate and gauge of the needle that was used to insert the position, what arm was used. So, I think that's it. Okay, so I'm in the patient's room. Mr. Jones, I'm here to take down your IV bag. Looks like it's all done. I'll go ahead and wash my hands. I got my clamp. All I do is just clamp this off for you. Take all this off. Okay, and clamp it. Cap it. The next person to use. Alright, that looks good. Like I said, I've washed my hands. I'm going to go ahead and, Mr. Jones, do you feel any pain? Do you insert site or anywhere else? No? Okay. Do you have to use the restroom before I go? No? Great. Let me get your personal belongings, and do you need to be repositioned? Are you comfortable? Great. Okay, Mr. Jones, let me know if you need anything. I'll come back, check on you. Everything else looks good. And that's when I would document again that everything was good. The IV line was patent. No redness, tenderness,